Hey everyone, Vanessa here, your favorite registered nurse. Today I'm going to talk about the types of questions you can ask your family doctor or your specialist when you go to see them. Keep in mind that you don't have to ask all or any of these questions. They certainly depend on your comfort level with knowing the answers and whether you want to ask them or not. So stay tuned. So the first set of questions that I'm going to review are questions you would ask your family doctor when you go to see them about the symptoms that you're experiencing. You're probably going to see them because you're concerned whether these symptoms are serious and something you need to worry about. This may be your first, second, or third visit about these symptoms. When you are talking to your family doctor, one question you might want to ask is whether they are familiar with a condition or a disease that might be causing these symptoms, and if they think it might be that one. The next question you can ask is if there's one or multiple diseases or conditions that they might think are present, or nothing at all. The next question is related to testing. So you can ask them what types of tests are they going to send you for. Are they blood tests? Is it an X-ray, ultrasound? Is it further imaging like a CT or an MRI? You could also ask the doctor what types of prep you need. Is this test requiring fasting? So should you not eat before the testing? Or does it require you to go in early morning or late at night? These are important questions. The next question you might want to ask is, will these tests be definitive? So after these tests are completed and you get the results, will you know whether or not you have a condition or a disease, or will you be required to go for further testing? The last thing you might want to ask are these tests safe? So tests can vary from how safe they are, from something like a blood test to something like a biopsy. A biopsy being an invasive procedure where they may have to give you local anesthetic or put you under so that they can get a sample of your tissue. This type of test would have more side effects than the blood test, as I mentioned. So those are just some beginner questions that you might want to ask your doctor. Of course, they get more specific given the symptoms that you might have. Another question that comes top of mind is if you are at home and you have pretty significant symptoms, when should you go and seek medical attention again is a good question to ask your doctor. So when does it become more serious that you should be returning before any testing has been completed? So the next set of questions are more specific to going to see a specialist. So this is after your family doctor has likely done some primary or preliminary testing, and then they're going to send you to a specialist who has more knowledge about a given condition or a disease. You may or may not have a confirmed diagnosis. So the family doctor might be referring you to this specialist doctor to make the diagnosis because he's not certain that you may have the condition yet. So the first question that you might want to ask the specialist when you go to see them is, how likely is it that I have the suspected condition or disease? The next question you might want to ask is, what are the long-term effects of this condition or disease? How will it affect me today, and how will it affect me in the long term? The next question is, what kind of treatment options are available to me? If I take these treatment options, what is my quality of life after the treatment? What if I don't take these treatment options? What is my quality of life without treatment at all? Some other questions you might want to ask with regards to treatment are, what are the effects treatment are going to have on my life or my body? Are there specific side effects that I should look out for? Now is another good time to ask the specialist about your symptoms. So if your symptoms worsen, what should you do? Should you make an appointment with a specialist? Should you seek emergency treatment? And then lastly, you should ask the specialist if they are aware of all of the medications that you are on, and if they foresee any interactions with the treatment and your current medications. That's all for now. Thank you so much for staying tuned. Don't forget to like and subscribe so you don't miss out. See you soon.